Under the Speaker's announced policy of January 3, 2013, the gentleman from California, Mr. Garamendi, is recognized for 60 minutes as designee of the Minority Leader.
Thank you, Mr. Speaker. Sorry for the confusion, and my apologies for that. We've just heard a remarkable hour of problems that really were so overblown as to be really not worthy of much discussion. But I think the American public really needs to understand what this last hour was all about. In fact, the Affordable Health Care Act is working. And it's actually working very, very well for millions upon millions of Americans. I just want to read some facts and then move on to what is really going on here, which is an effort to try to leverage the necessity of funding the federal government. That is something we must do every year to provide the money to continue all of the work of the federal government. They're trying to use that as a lever to gain something that they've been unable to do in a presidential election year. Last presidential election year, the issue of the Affordable Health Care Act was front and center, and the American people heard more than a year of debate about the Affordable Health Care Act, whether it was good or not so good, all of the benefits and all of the problems that it might be. And at the end, November of last year, the American public decisively said that the Affordable Health Care Act and President Obama should continue. That was the decision by Americans. And in the House of Representatives, we gained seats on the Democratic side, and I think about 2 million more Americans voted Democratic than they voted Republican, although because of the redistricting and the gerrymandering, the House remained in Republican hands. Now, just understand what's going on here. What could not be achieved in the democratic process of an election is attempted to be achieved in two absolutely critical moments in the annual processing of the federal government. The first moment, it comes up on October the 1st, the necessity to provide money to carry on all of the tasks of the federal government. Social Security Administration, the national parks, and on and on. Every aspect of the federal government has to be refunded, or nearly every aspect has to be funded every year. That is a moment that is now being used as a lever to try to achieve what could not be achieved in an election. After all, as America, this is a democracy. We make our decisions through the electoral process, not by trying to lever, using a critical moment, basically the funding of the American government. Now, in 2 or 3 weeks beyond October the 1st, there will be yet another moment of critical importance, and that is the ability of the American government to continue to pay its bills. It's called the debt limit. Heretofore, well, actually until 2011, this was a routine process in which the Congress would continue to say, okay, we will increase the debt limit so that we can pay our bills. It was done during Democrat and Republican administrations routinely. There was always some discussion about the debt and about the deficit, and as it should be. And in fact, the President, Mr. Obama, when he was in the Senate, railed against this issue of deficit. Oh, now he's on the other side of it? Okay, that often happens. But the fact of the matter is that in this process, these two moments of time are now being used as a lever to achieve in the legislative process what could not be achieved in the electoral process. So much for democracy. Now, just a few facts about the Affordable Care Act, or Obamacare as it's come to be known. Nearly 13 million Americans have benefited from over $1.1 billion in rebates from insurance companies. I was the insurance commissioner in California for 8 years, and I knew then, as I know now, that the insurance companies were overcharging the public for their health insurance policies. However, I did not have any authority under California law to order rebates. The Affordable Health Care Act sets up a system that requires the insurance companies to pay at least 80% of the premium dollar for medical services. If they don't, they have to do a rebate. It's the law that they want to repeal. Okay, $1.1 billion. 105 million Americans, including 71 million Americans in private plans and 34 million seniors in Medicare, have received access to free preventative services. You want to hold down the cost of medical services? Do prevention. The Affordable Health Care Act requires that every insurance policy, including Medicare, provide a free medical checkup every year. Guess what has happened? The cost curve has bent downward. Why? Because serious illnesses are either treated or delayed. Diabetes, strokes, heart conditions are analyzed early and treated, reducing the cost of health care and, far more important, keeping people alive and healthy. Moving on. 30 million women are receiving free coverage for comprehensive women's preventative services, including a well woman visit and diabetes screening. They want to repeal that. 30 million American women receiving free diagnostic care. They want to repeal it. 17 million children with pre-existing health conditions can no longer be denied coverage. I was the insurance commissioner. I cannot tell you the number of times that I begged for a law that would require insurance companies to continue or to provide insurance for a newborn child that had a serious illness. Time after time in California. Insurance companies would insure the mother for the delivery, and the moment that child was delivered, the child had no coverage. Bankruptcies and lack of medical care ensued. 17 million children will be denied health care coverage if they are successful in repealing the Affordable Health Care Act. 17 million children. 6.6 million young adults to the age of 26 have taken advantage of the Obamacare law, the Affordable Health Care Act, to stay on their parents' health insurance plan. Do you have a kid in college? Do you have a kid that's graduated from college that's 21 or 22? They can stay on your plan. Before the Affordable Health Care Act, before Obamacare, they had very little opportunity to get insurance. They'd have to go out and buy their own policy. They were able to stay on their parents' policy. 6.6 million young adults that will not be insured if they are successful in repealing the Affordable Health Care Act. 100 million Americans no longer have a lifetime exclusion. Previously, most health insurance policies in the United States set a limit on the amount of coverage that a person could have during their lifetime or in a given year. 100 million Americans no longer have a lifetime exclusion. 100 million Americans are able to get comprehensive coverage for the duration of their illness. They want to affect the well-being of 100 million Americans. You've heard about the senior donut hole.